Assalamu alaikum and hello. Welcome to the Mindful Muslim podcast. And on this session, I've been joined by the amazing Dawn. She is a clinical psychologist and has been working in the field for about 20 years. It was an amazing, eye-opening conversation, and I really hope you enjoy it. Make sure you follow Inspirited Minds on all of our social media platforms, and we'd love to hear your feedback as well. Assalamu alaikum. Assalamu alaikum, Dawn.
Alaikum salam.
Thank you so much for joining me on the Inspirited Minds podcast today. Shall we start with who you are? Tell us a little bit about yourself so that you can introduce yourself to our listeners and our viewers.
Okay, I'm a clinical psychologist by profession. I qualified in 2000. And I work mostly with older people, and I have done since I qualified. I've done a little bit of teaching as a psychologist as well. So in my current position, I'm kind of split half and half, clinical and teaching as well.
Fab. And you've been a clinical psychologist for a while, I understand.
So it'd be about 21 years now. Yeah.
So what actually motivated you in the beginning to become a clinical psychologist, and what were you doing before then? Was it studying or something else?
What motivated me? This is a good question. So while I was at university, I had what they call a thin sandwich course. So you did placements every 6 months. It was a 4-year degree. And during that time, I did a placement for 6 months at a prison. So I then became interested in forensic psychology and wanted to do that after I finished my degree. You have to go through a process with applying for the prison service. Anyway, I didn't get through that. Then I also had an idea I might be an educational psychologist. Then I discovered you had to be a teacher before you could do that. And at that point, I'd had a joint degree, social anthropology and psychology.
Right.
And I was told there was not enough sort of like hard subjects like maths or whatever to be able to apply for teaching training at that point. So then I was left with what's next. So I thought, okay, we'll go down the route of clinical, which everyone tells you not to because it's really hard to get into. That's what you hear from everyone. But I got lucky, and I think I got lucky because I had that experience at an undergraduate level of working in different sort of environments. I'd worked in educational psychology service as well towards the end. And I got an assistant job in Chichester, the south of England. And so that kind of like started off an interest there. And while I was there, the other assistants were applying for clinical courses, which I didn't know anything about at the time. So that was an education. So I thought, okay, I'll go along with that. We'll do what they're doing. And got lucky and got in. I got an offer for Surrey University, but wanted to go to a place called Salomon Centre, which is in Tunbridge Wells at the time. It's part of Canterbury Christchurch University now. And so I started my training there.
Oh, brilliant. I wanted to ask you something off of what you said. Your first degree, what was that actually in? Was it psychology based?
Psychology and social anthropology, so it was a joint degree.
Oh, I see. So after that you had your role in Chichester, and that's where kind of things started with clinical psychology. And how long was the training when you were at Christchurch, I suppose?
So it's a 3-year doctorate. It's a clinical based doctorate, so you do part study, part work. So different courses work in different ways, but the one I was on, you did 3 days a week on a clinical placement, and 2 days a week you were university based, so you're studying.
Sounds really exciting. Was there a lot of people on your course, or what was the experience like for you those 3 years?
Often courses are quite small, used to be, small numbers. When I started, they were slowly increasing the numbers. So as I understand it, where I was, they'd started off with quite a few, like maybe 12 or something. By the time I was there, we had about 20, I think, in our cohort.
And this
around
was the year?
20. This would have been 1997. So it started to increase a little bit.
Sure.
And you go through 3 years with that. But different courses are different. So the London courses are typically bigger. They've always been bigger. And more recently, just the last year, the government funded a lot more places on the courses at different points around the country. So, for instance, Hertfordshire course now is much bigger. It's like 50, around 50, I think, just a bit more.
Yeah,
whereas it would have been perhaps 20 or less not so long ago.
And how did you spend those 3 years sort of studying, working? Did you have any regrets? Did you think, I'm so glad I chose this? Or
it's stressful. It's very stressful. And you don't realise it while you're in the middle of it either, I think. Right. Though everybody's telling you it will be stressful, you don't quite appreciate where the stress is coming from. So you've got your own clinical caseload, for instance. You're, for the course I was on, you switch every 6 months as well. So where I was at, you started with an adult placement and then moved on to, I think it was child next, so 6 months each. And then there was a learning disabilities, then older adult, and then in the final year you can choose different specialties that you might like to go into. But again, every course is different. And I know now, because the courses have expanded, it's not necessary that you can do those discrete like departments, different types of services. You might have to change it up a bit. But basically now it's more focused on like core skills.
I see.
So you work in a hospital department, you could work in a community team, you could work in a ward. So you work in different services wherever they can find like the supervisor. So you have to be supervised by a clinical psychologist in that particular
And as you say,
area
that's
of
part
work.
of the course that you were on. Once there was a supervisor, then people were sort of sent in those directions.
Yeah, and it could be, so it covers a particular region as well. So you'll live in one part, but you won't necessarily be working in that part. So for me at the time, I lived in Brighton. I worked out in Horsham, which is a few miles up, what was it? It's the A23, I think. Then I worked in Brighton itself. Then I went across to Worthing. And then I was up in London for about a year because I did an older adult placement in London and then managed to do extend it as a specialty placement.
Okay.
And then I did another placement in what was it called? Not Haywards Heath, somewhere nearby. So yeah, you can potentially move around.
Right.
Other people I've known, they live in London. Maybe they can try and get placements around near where they live, but you might have to go further afield. One person I know that ended up having to go to Ashford in Kent for about a 6-month period. So it depends which region your course covers.
Right. And what kind of were the reasons that it sounds like older adults was your interest at the time and is now? So what kind of led you on to that? Was there any particular reasons?
The first assistant job I got was with older adults, and I wasn't keen because I thought, oh no, don't fancy that. Just had ideas of, my grandparents. I'm not sure this is what I want to do. But because it's very hard to get an assistant's post, I just thought, okay, we'll go with it. So I just thought I was lucky to get an assistant post. But actually I discovered I actually really liked it. I liked working with older people. I liked their life stories, the richness of life stories they came with, and the different aspects of the work as well. So for me, in older adult work, there's quite a rich mix of psychology. So you can get involved in the neuro aspects of psychology, the sort of comorbidity with health issues, and then just psychological issues as well. So that was the preference for me, I discovered anyway.
And you mentioned earlier about teaching. How did that come about? Where did you do it?
So when you're qualified, or even as an assistant, you'll be asked to potentially get involved in training. It's like one of the key skills as a psychologist. It's not just sort of therapeutic work. You'll often be asked to get involved in training or teaching. So even as assistants, you might be asked to do like a little training package or teaching to other staff members during a business meeting, that kind of things, like CPD work. But even as a trainee as well, when you're in the doctorate course, you might be asked to get involved in some level of teaching and training. So it's a key skill. So all along I was involved at that level doing that, which the first time scared me to death. Teaching's very nerve-wracking, very anxiety-provoking, but my experience, once you do it a couple of times, you kind of figure out how to get over the initial nerves. Don't know how you find it.
Yeah, I understand. So you had that sort of experience of presenting and CPDs and a bit of training, and is that what led you to some work in Saudi Arabia?
Yeah, so when I was qualified, when I started, I would say, the first job I had after I qualified, I did a little bit of joint teaching with a supervisor in the Institute of Psychiatry. He used to do some teaching there, so I joined him to give a couple of, a session that was on psychosis in older adults. Then as I worked in Leicester, I did a couple of teaching sessions at the University of Leicester's course. Again, the courses are in close communication with local clinicians, so they'll ask if anyone's interested in providing some sessions. So like they're not providing everything. They like to bring in clinicians who are actually working in the field. So that kind of gives you a little bit of a experience. Lots of people don't like to do it, wouldn't want to do it, and that's fine because it's not everybody's cup of tea. But I found I quite liked it. I liked working with other psychologists, preparing material and actually doing sort of like workshops, delivering them. So I had a little bit of experience, not a lot. And then when I lived in Saudi Arabia, I got bored. I needed to work. I just had a baby, but after a while I just felt a bit itchy for work. And I was lucky somebody knew somebody who was actually a student at a university, and they just started the university had just developed or was developing a course in clinical psychology for undergraduates, which is quite unusual because pretty much all over the world you'll learn clinical psychology as a graduate. Right. Just do a basic psychology degree as an undergraduate. But in Saudi at the time, they wanted to increase and expand the psychology workforce, and they wanted to do it quickly. So they wanted a specific focus on clinical psychology. And so I went and spoke to the people on that course. At the time, that was being run in collaboration with Erasmus University in Holland. Yes. And I was asked to get involved and develop the curriculum for more specific clinical psychology modules. Right. So that was my involvement there.
Amazing. So what was the experience like? What did you sort of take away from that role of being involved? Seems quite heavily on the curriculum and what these undergraduate students were able to experience. It sounds like a responsibility at the same time. It was really interesting. Quite hard to think how you teach to an undergraduate level what you know at a postgraduate level, and how you can change that up. Sometimes you can't, you just got to teach it. Luckily enough, that university, they do more sort of like, you wouldn't do a 3-year degree in Saudi. They do like a foundation year in general topics, and then that particular course they went on for about 4 years. So they're almost nudging at master's level anyway towards the end, so you can teach them a little bit more beyond the basics of psychology. I would say it was really intense. There was a lot to do, a lot of practical skills workshops to do, which was interesting because that wouldn't necessarily be the mode of teaching that people were used to. A lot of trying to push people into more sort of like critical evaluation skills. That was also something a bit new. The Erasmus program liked to do, I've forgotten what the word is. It's a certain style of teaching. PBL, that's it. Yes, problem-based learning.
Yes, so that's like how they like to teach things. Right. So students were being like sort of coached in how to do that. So more, again, critical evaluative skills, discussion, that teamwork, that kind of thing. And they were really good at it. Really good at it.
Good, amazing. So what kind of happened after your experience in Saudi? Did you move house, or what happened after that?
requirements in university, things were changing. Saudi changes really fast. Saudi's always changing. My reasons for all the curriculum had been developed, the different modules had been done, and there were some changes in how the organisation was working. I felt it was time to leave, and it was around that time, it's the right time for my children to come back as well, for education.
Brilliant. What do you think has been one of the most rewarding part of your career so far? Or maybe early career, I suppose that's what we're on right now.
I would say the time in Saudi.
Right.
Actually, it was really nice to almost, you had a blank sheet of paper, not completely. They had an idea of what they wanted to teach, the learning objectives in different modules, but that was it. So you took like a paragraph of description of what they wanted, and you had to create like a 12-week course from it.
Wow.
So that was an interesting experience to actually discover I could do that. And I wouldn't have had that opportunity unless I was in clinical psychology. So.
No, as you mentioned, it was intense and I'm sure stressful and just an awful lot of work to do. What do you think was sort of the highlight of that role for you, or anything like in your memories that sticks out, any kind of particular experience there?
Seeing the students develop, definitely. From, learning more in depth about the specific clinical psychology and then going on to work in it, because they developed the course towards the end and did like a 5th year where they were like on a placement. So they had to go and work in a hospital or a clinic or some other service that would be psychology based, and you could see that they were using those skills there.
And essentially
really
they'd
good.
gone through your program in order to, develop those skills in the first place.
There was lots of other people there as well.
Right.
We still had a lot of Dutch teachers, and there was some teachers from Pakistan as well, clinical psychologists from there. So it was just nice to see how students develop, and the confidence developed, and their understanding of psychology developed.
Brilliant. There's some misconception about what clinical psychology actually is. So how would you describe it?
That's a good question. What would be the misconception first?
I suppose the kind of job that it is, or just not knowing exactly what it would entail as a day-to-day. As you mentioned, there's sort of different aspects to the job, whether it be teaching or seeing clients face-to-face.
That might be the biggest misconception, is being a clinical psychologist is just about therapy.
Right.
That's possibly maybe some people's misconception. I would say it was more than therapy. I think it can differ in different countries as well, what clinical psychology is and what they do. So in this country, for instance, you have to do a doctorate level to be qualified as a clinical psychologist. I know in Europe you don't necessarily have to do the doctorate level. You could do masters in different countries and still be a clinical psychologist. In America, I believe you go to the doctorate level as well. But it varies. A lot of countries are more masters level. Clinical psychology, what is it? Well, it is therapy. You hold caseloads often. You see clients, patients, not necessarily individuals. Could be families, could be couples. You work with services, you work with teams, so you don't necessarily just work with individuals. You may be asked to consult with teams and how they're working with particular individuals. Be patients, how they work as a staff group. You can do what they call reflective practice groups, a staff group, a team. Spend some time reflecting on the stresses of the work or any particular issues that are going on, and you help facilitate those groups. Like I say, you can do teaching, training. You get involved in a lot of things, actually.
Yeah, it sounds really varied and not something that's sort of the same every day.
No, it isn't.
Are there any things that you can recall from your career that kind of stuck out to you, or that you can recall now that was like a particularly interesting caseload? Or
I think it can be interesting where you can develop services. So again, the more experienced you get, and even less experience, there's always an opportunity to develop something. So you get to be perhaps innovative evidence-based but innovative. You can work in a service and think, oh, there's gaps here, or I might want to run a group here. There's not much of that happening, and you can come up with your ideas. You can find a package that maybe is already running, already been developed, or you can develop your own one. So you've got the opportunity to be quite creative.
And also maybe implement change.
Yes. Yeah. Definitely.
And that's something that's sort of driven you, or something that an aspect that you've really enjoyed.
I think the training that you get as a clinical psychologist, you're always assessing everything without realising it. So the fact that you do a lot of perhaps one-to-one work doesn't mean to say you're not looking at your environment or your horizon and thinking, oh, okay, how does this system work? How is the organisation working? What other factors are going on here? You're what they call formulating all the time. You're not just providing formulation for an individual. You're sometimes thinking about the service and the group that you work in and thinking, how can I improve this? How can I develop this? Is there a better way of doing it? Checking with clients, what's their evaluation of what you're providing as a service as well. So psychologists get involved in sort of like QI projects a lot as well, auditing, evaluation of services. Again, it's not just therapeutic work.
Yeah, no, I absolutely had no idea of the vastness of it. So that's amazing to know. I'm sure our listeners and viewers would appreciate that, definitely. My next question is, what does a typical day in the life of a clinical psychologist look like? And I think we've sort of touched on that a lot in terms of it can be varied.
It would be very difficult to pin it down because every psychologist's experience would be different, because it would vary very much with the service that they're working in as well. So you'll get psychologists working with homelessness services. You get psychologists working in learning disability services, maybe in group homes. You've got psychologists working in neuropsychology services, perhaps with physical health issues, strokes, that kind of thing. So cardiac problems, you get psychologists everywhere.
Right.
They're not just in your specific mental health services.
Yes.
They're spread around.
Yes. If we talk about the UK, and in your experience, would you say that there's a need for more clinical psychologists in the workplace?
The government seems to feel so. Yeah, they're definitely expanding positions. Since I've been working in psychology, I feel that there's been a huge expansion of clinical psychologists more in the health aspect, physical health aspect. So you'll see more clinical psychologists working perhaps in diabetes care or cardiac care or perinatal services. It's expanded a lot. There was always potential to have worked there, but perhaps the posts weren't there. But it seems to have exploded. And my experience of working overseas as well is that psychology in general has exploded across the world. It's definitely something that governments are looking towards, creating more jobs and like increasing the workforce skill in that area.
Right. And I guess, again, in your experience of working in different places but also in different roles, did you feel like there should have been more clinical psychologists? What I mean by that is, if there were more psychologists, would there have been less pressure on your team, for example? Just in terms of the workforce, are the numbers sort of not enough for what we might need, if that makes sense?
Yeah, there's not enough clinical psychologists in post. There's still lots of waiting lists in different services.
Right.
Different professions are getting trained in specific areas of psychology. So you'll get a lot of other professions trained in sort of CBT therapy and can provide specific therapy to specific cases, services. So psychologists are not the only one that are using psychological knowledge and skills. But they're typically a wanted resource. They always seem to want more of psychology. Sometimes services can't quite tell you why they want more of psychology, but they're always asking for it.
What are the main areas you work in as a psychologist now? You mentioned earlier about older adults. Where are you based now, and how long have you been sort of in that role?
So at the moment I work in an inpatient unit for older adults, so a psychiatric unit. What can I say about that? It's, again, people come into a unit, they're much more severely unwell, if you like, so it can be very tricky to perhaps people consider more classical psychology. You know, it's not always possible to do sort of like one-to-one work with people who are in their worst state of distress, really. So you'll perhaps work with staff a bit more, or assess a bit more rather than just do therapy. You're looking more at what they call formulation, so thinking about what's contributing to the person's level of distress at the moment, and what things might help. So not just medication.
So the work that you do now, full time.
That's part time.
Part-time.
Yeah, that one.
And you're on this unit every, for you as a part-time role. What are the things that you see most often, do you think, in patients? I mean,
in older adults, I don't think I see anything most often. I see a range. So I think there's a misconception that older people services is all about dementia, and it isn't. You've still got people who are older and they get depressed, they get anxious. That doesn't necessarily mean that they have a dementia. You can live a long life and not have a dementia or a cognitive impairment of some kind. So the service I work in is what they call functional mental health. So you've got people who are not primarily dementing or with a primary diagnosis of dementia. There's another ward for that specifically for dementia care.
I see. And what do you think are the challenges that your service or you yourself sort of personally face?
Again, it's about demand. So there's always more demand than there is service. That's just the nature of it. So, people are being looked after in the community as best they can, but a community team can only go so far. Sometimes there's only so many people in a community team. So, as I say, there's, you'll have waiting lists for different services. Although people non-psychologists in a community team, again, they can be skilled, they can have done extra training, provide more psychological approaches to care.
Right. And apart from sort of more psychologists or more of the workforce available to help patients, what do you think could sort of help solve or make this a better service, apart from just having more men on the ground, is what I mean?
They are developing services. So the government, workforce confederations, these different groups that plan for professions. So they created a new profession. It's called Clinical Psychologist. That is more established in Scotland. So they've had that a little bit longer in Scotland. And what it is it's a role between assistant psychologists and clinical psychologists. So an assistant psychologist would typically be somebody with an undergraduate degree in psychology that works alongside a clinical psychologist and gets involved in, can get involved in anything actually in a service, as long as they're supervised by the clinical psychologist. They won't have they shouldn't have huge caseloads, that sort of thing. They do specific pieces of work. But there was nothing in between, and there's what they call a big sort of funnel neck in trying to get to clinical psychology doctorate courses. So there's lots and lots, thousands of people applying, but there's only a few number of spaces. So, there's this bottleneck, basically. So what they've done is created this new profession that's in between. It's a master's level, it's an apprenticeship. So you're employed by a trust as an apprentice, and you work in a trust, in a service, for about 4 days a week, probably 3.5 actually, and then 1 day a week you're sort of university based, you're being taught, and half, that's why I say it's probably 3.5, because half day a week you should have study leave. So they are trying to expand the psychology, as they call it, psychology workforce, by bringing in this new sort of in-between role. Interesting.
If I recall correctly, I think I've heard something similar, maybe in the medical profession, I think they're called medical associates, I might be wrong, but something that has I suppose, come across from America is what I've heard. I think that might be a similar idea to increase the workforce, to become an associate, I believe, in medicine, but yeah. I wanted to ask you a little bit more about any trends in individuals that you see what they're struggling with most. But I guess you touched on that there might be a misconception that it's all dementia in older adults, but it's really not. It's quite varied.
It's very varied. I mean, mental health is very varied, really. If I was to think if there's any issues, I mean, I suppose obviously the last 2 years, the biggest issue is around uncertainty, I think. Not just social isolation, but the whole uncertainty about it. Social isolation is a huge factor. I think people didn't realise perhaps how sociable they were. I think, just perhaps going shopping or window shopping, that sort of thing, and not necessarily meeting people, we don't necessarily think that we're being sociable. But when that gets taken away and you can't even just be around people, that has a huge impact on some people's mental health. Yeah. The really strong sense of isolation.
Right. I guess that's sort of linked to loneliness as well, and how that's a very big factor in mental health challenges that people face. And then you're a part of the Muslim community yourself, and there's some stigma around mental health. Have you found this in the work that you do now or previously? I guess how Muslims interact with the services that you've been a part of.
I think that also varies. I think you could go down the route of thinking it's a generational issue, but I don't think that's necessarily holds with everybody. Right. I think there can be a suspiciousness about psychology. I've definitely heard some ideas around some generations thinking that it's not acceptable. I've certainly had people say to me their parents said that they couldn't study psychology because it was haram, because of what they felt was in the content. People spend too much time just thinking about Freud and psychology, which is a very small issue. You could probably go through a career in psychology and never look at Freud properly. So yeah, I've definitely heard people being pushed away from psychology. Yeah. I've definitely seen that people are not sure about seeing psychologists. I think to see a psychologist, you've got to be fairly open and be prepared to talk about a lot of things. For certain cultures, that's not the norm. You don't talk about certain things. I certainly saw more of that in Saudi, for instance, while you were talking about some of the content, some of the nature of the different approaches you use. It just didn't seem to lend itself very well. You wouldn't be able to have that conversation. One thing that specifically came up, like, you wouldn't be able to have a conversation that perhaps is a bit critical about your parents. And so how would you properly assess someone's situation without doing that? So I remember having a long conversation about that with somebody once. So it's useful, and I think more people are using it and becoming less hesitant about it. And it can be adapted as well. It doesn't have to be delivered in one specific way. It can be adapted to people's different belief sets.
Absolutely. And in your work now, is there any one person or project that you've been on that comes to mind where you have seen that individual or that group or that family sort of not want to be involved, but they've sort of come and they're not really sure, and then there's something at the end that sort of works out for them? Or
I think younger generation are more open to it, so they're perhaps having more of an influence on the older generation to be a bit more accepting that this is a way that you could work with mental health issues and even physical health issues. When you're working with psychology, you're not going in analysis. That's psychotherapy. That's not psychology. That's not clinical psychology. It's something different. It's a different field altogether. So clinical psychology, it's basically helping you with your particular situation and seeing your strengths, trying to assess what strengths you've got individually in your system, around you, your relationships, and try and work through whatever issues you've got. And encourage you to do that. So it shouldn't be about the psychologist coming and saying you must do this, this and this. They're assessing what your situation is, what you're capable of, what might work for you. Let you lead you're sort of like changed, that you lead therapy.
Sounds very tailored and sort of specific to that family or person.
Yeah, you could. I mean, a psychologist might work in a particularly structured way, but then when you're faced with each individual, you have to change it slightly to work with the individual. Or an individual's going to, as we say, vote with their feet and not come back. So.
Great. Are there any myths that you've heard of or read about as a clinical psychologist?
I think there's always the classic one, if you meet people for the first time and say what you do, and they're like, oh, you're going to read my mind now. It's just that you're not the person that people want to go and spend time with typically if you go somewhere new. Somebody will go and speak to somebody else once they discover what you do. So you definitely can't read people's minds. And perhaps the idea that you're a psychologist all the time, you don't have any time off. It's like, as a psychologist, why would I be wanting to think that way all the time? I can just be sociable and not be looking at someone's inner motives for doing things.
Yeah, and keeping sort of work and your personal life separate is very doable.
So there's sometimes a little bit of suspiciousness, I suppose.
Yeah, absolutely. Let's think a little bit more about faith. I guess we touched on Muslims in particular. How do you think faith comes into your work? Does it?
That's a tricky one, because you can't, personally in this country, I feel it's encouraged to keep the two separate, and it gets complicated. I would say, again, working in a different country, a Muslim country, that was always there. It was always something that had to be considered. Even to the extent developing a curriculum, you were told that you have to think about how this fits with the religion and how it fits with society and how it fits with cultural norms and values. So you had to think about that. So in this country, I know there are some people that work more focused on faith aspects. I think if you've got a client, you're working with someone where faith is very important, you have got to work with faith as well. Yeah.
But in your role, I'm sure you see people from all sorts of different, faiths, no faith at all. What's that like for you?
I don't know what other people's experiences is, obviously. I can only speak for myself. But sometimes I think it opens up a conversation that perhaps people don't have with another person that they don't obviously associate with faith. So they potentially feel a bit more comfortable talking about their beliefs. And that's not just Muslims either. So it could be Christian, Hindu, any faith. Because you're more obviously, they assume you're obviously of a religion. You're not hiding it in a sense. I think they don't hold back from that conversation. I wonder if you have potentially more in-depth conversation about that. I think that can be something people are a bit hesitant about when they don't know a lot about the other person, right, the other therapist. They might not be so open about what level of beliefs they've got. That's my personal experience anyway.
So you found sort of openly in appearance and etc. that you are Muslim has actually helped you in your work?
Sometimes, with conversations with some people,
How do you think seeing a therapist who's from your faith and culture is better than someone who isn't from your faith or culture? Do you think it matters at all? You mentioned a little bit about...
I think it depends on the person. So not necessarily the therapist, but the person coming looking for therapy, the person who's wanting the service from clinical psychology. I think if they're comfortable and they can open up with someone who's not of their faith and they find that's more useful because they can talk about more things, perhaps. Some people might feel that they're more judged. Not that they would be, but they might feel more judged by somebody they think is more faith-based. And other people may want someone who's more obviously of certain faith because they feel that perhaps that person understands them a bit more. They don't have to explain themselves so much. So I think it really depends on the person seeking the service.
I'm so glad sort of that we are talking about this question, because I think sometimes, I've assumed before that if I want to see a psychologist, I would prefer them to be of my faith, but as you say, people want different things. So I think that's really important to bear in mind. what advice would you have for budding psychologists, or somebody listening or watching us now who might want to enter psychology and think about clinical psychology as well, now that they know so much more about it?
I would say don't ever let someone tell you can't do it. That's the biggest thing I hear consistently. And so I started my training in 1997. I'm old now. I did a degree, when did I start my degree? 1991. And I remember going to the careers service towards the end of that degree, so that'd be 94, 95, and being told, oh, don't bother with that, that's really hard to get into. So even before you've tried, being told very early on, this is really hard, don't. So that would be my first thing to say to people. If you're really interested in it, just go for it. It's not going to be easy. It's not plain sailing. It is hard to get into those different jobs. You need to get yourself some clinical experience. You need to work in some sort of clinical area, not just caring. A lot of graduates will go into sort of caring roles. Could be care homes, could be a support assistant on a ward, that sort of thing. If you're going to do that, you need to do something extra as well. My personal experience, I found if you got involved in some voluntary work, that might help. There are lots of voluntary groups, lots of charities who are working more sort of therapeutically, so that can help.
Widen the horizons a little bit.
Absolutely, yeah. If you can get involved in any kind of research, that really helps. That's something I've not mentioned. Psychologists do a lot of research as well that makes you stand out a bit. So you don't get stuck on the fact that you have to have an assistant psychology post either. You don't necessarily have to have that. There are many people that have become clinical psychologists and they never had an assistant post. But you've got to think about what are the skills, what are the roles of clinical psychologists, how am I meeting those in my actual work experience. You've got to have a little bit of a plan, really. And
get those skills under your belt. And it can be through different means, as you say.
Yeah, it doesn't just have to be about a caring, helping sort of role for others.
Yeah, the normal or the go-to that we think about.
Yeah, and charities and voluntary groups, so they give you extra training as well. So you can go places, get extra counselling training or do counselling courses, that sort of thing. There are other things that you can take control of rather than just feeling, I can't get in.
Absolutely. And apart from sort of those experiences, are there any particular resources that you'd recommend?
What kind of resources are you thinking?
Anything outside of going to work with charities or getting yourself some experience or becoming an assistant. Any kind of readings or other things that you'd recommend to
I think there are a lot of social media groups now, lots of groups talking about, there always has been, but now it's a lot easier to share information. So there's lots of people sharing information, experience about being an assistant or getting their first assistant post or applying for clinical doctorate positions. Now obviously there's more groups talking about clinical associate psychology and how to get into that. So there's lots of information out there, a lot of sort of like previous experiences, people doing that. I'm not sure it'd be easy to necessarily contact a clinical psychologist off, just out of the blue. I don't know that many people answer back to that sometimes. Some people do.
Yeah, it's worth trying.
Yeah, to get some help, to get some ideas, where to steer yourself.
Absolutely. It sounds like there's just lots of avenues now that you can explore. This is, I guess, one of the ways to understand quite a lot more about what the role entails.
Yeah, there's the BPS will tell you a bit about how to get in, but it's typically very sort of limited in how they can help you. They just give you information. Yeah, the British Psychology Society. Okay. But probably more useful is actually finding networks of people.
And I guess finally, is there anything you'd like to share with those that are struggling with mental health and feeling reluctant to seek therapy or help?
I would say learn perhaps more about how you could be helped. Maybe the reluctance is the not knowing, not sure what kind of help you'd be offered, not sure how that would be delivered. so a little bit uncertain. People worry about being judged, don't they, by others when you sort of admit that you've got psychological issues. So I would say perhaps go into it a bit more, see what services there are around you, but don't keep it to yourself. Speak to family members. Not every family member is the right person to speak to. There's always someone in the family you can talk to. There's always some friend you can talk to. There used to be GPs. I don't know that they're so easy to access now. But again, there are voluntary organisations. You can pick up a phone, talk to people. If you don't want to talk to someone, there's, like messaging services and things now. Don't sit alone with it. If you can, 'cause when you're in your worst, you just don't feel like you can do it. No. Try not to be alone with it. Try and seek help. And if that person is not in the position of seeking help, again, people around that person, if you notice that there's somebody struggling with their mental health, then, give them perhaps little bits of a nudge, give them little bits of information about where they could go. Apart from helping them yourself, see if you can find
resources or places that they could turn to.
Yeah.
Absolutely. I guess it sort of brings us closer to the end of our conversation. Was there anything that I didn't ask you, or anything else that you wanted to share at all today?
I don't think so. I probably missed out lots. If there's a psychologist out there or someone involved in training listening, they're probably thinking, oh, that's not my experience of psychology, or, oh, she didn't mention this. That's fair enough. That's just my personal experience. There'll be lots of things that I've missed. People working in different services will have a different view of how it works. So that would be the take home. It's very varied, very varied. And because it's so varied, it's got space for so much more.
Yeah, absolutely. I think for me personally, you've definitely broadened my understanding of what clinical psychology is and the type of person that could be in that role. So thank you so much for that and for joining me today, and thanks again.
Welcome.
Jazakallah khair for joining us on this episode of the Mindful Muslim podcast. We hope you benefited from this episode, inshallah. Make sure you like and share this video. Jazakallah khair.